pouring love into others seems to be a deep driver for you in terms of your purpose and your why. Tell me a little bit how that's manifesting itself into what you do today.
What I do today is a very holistic, integrative medical practice. But although I do see a lot of people who just want to optimize performance, the vast majority of people I see have significant serious health histories that no one else has been able to figure out. And so they come to me having been somewhat traumatized by the medical system, somewhat skeptical about what's possible. And so providing that real loving environment in which they can start to share with me what's gone on so that I can help them unravel what their issues are is a fundamental piece of what I do. Making that connection is essential to allow them to share with me what I need to know and for them to start the process of trusting that I can help move them into something that's not part of conventional medicine. What I do is not conventional medicine.
You've obviously spent quite some time reflecting on your life. Spending time by yourself is nothing strange to you. Have you looked at the legacy that you want to leave behind? Have you examined what that may look like?
You know, I love intimately interacting with my patients, really getting into what's really important to them. And the feedback I get is that people really appreciate that because that's not commonly done in medicine. I really try to make that love a sacred container that we can have to have that experience, that medical experience. And there seems to be a joy, more of an enjoyment in life, a relaxing, and especially when you can help someone who doesn't feel good start feeling better. Oh my goodness, it is such a rewarding experience. And so the legacy would be that maybe people would say, you know, he brought me more joy, more pleasure in my life. I enjoyed my life more as a result of interacting with him.
Still on the legacy question, from a much higher perspective in terms of how we heal people today, if you could change one thing, what would it be?
Wow. Certainly a big part of my talk was about love, but getting down to the pragmatics, I've specialized since 1980 in treating parasites and other digestive invaders. It is, in my experience, a huge elephant in the room in medicine in America. For the most part, it's considered not an American problem. It's a third world problem. We don't really have it here. And so if we could start to really get good diagnosis and treatment of those issues, then everything else in healthcare would run more smoothly. If you have unfriendly invaders in your digestive system, compromising your microbiome, and this is huge now in medicine, the microbiome is everything. People are looking at the bacteria and the yeast and the fungi. No one's really getting down to this parasite issue. And if it's there, it will undermine your ability to have an immune system. They estimate 70% of your immune system comes from your intestines. It will undermine your ability to make neurotransmitters. It will undermine your ability to digest food, and on and on. So it's a huge piece that needs to be addressed. And if it is, then the way to treating much more complex problems, let's take Lyme, for example, which is huge right now in America. If you can get rid of that underlying parasite or bacterial infection in the intestines, my experience has been it becomes much more simple and rapid to eliminate the Lyme.
So it's fascinating. I mean, at least to me, when I think of the word parasite, I don't think it's a problem that we have in our world today. As you said, it's a third world.
Yeah.
You did mention Lyme. which especially around here in Pennsylvania,
Yeah.
I know, what, 3 people off the top of my head that have Lyme disease.
Yeah.
So that's also parasite driven.
Yes, absolutely. And I think that's a primary piece of why people are not getting good responses. If you go online, everybody's, oh, it's for the rest of your life, it's years, it's terrible, is they're not getting down to the fundamental foundation issue. And if you get that out of the way, then you can move forward with the branches on the tree. Right. Yeah. But so, you're right, parasite problems in America, no, it's not here. Right. But if you watch the news, a little bit ago, McDonald's, several hundred people got sick from one every few months. Oop, now it's okay, you can trust it. And then on it goes again. Right. Yeah.
So if you were to write a book today,
yeah,
what would be the title?
Wise Medicine. That's actually the name of my clinic. I think while certainly there needs to be more love in medicine and more real caring, our medical system in America is not in good shape. I think most people would agree. But starting to have an approach that is wiser, that's more strategic, looking at, okay, what are the fundamental foundation issues that we need to address before we start dealing with other pieces of the medical puzzle. Yeah. And that is not an easy thing to do when you've got 5 or 7 minutes with someone to go, hey, because the insurance won't pay for more than that, right? So we have to rethink a lot of what we're doing.
So, 3 words.
3 words.
What is your meaning of life?
Let's see. I'll see if I get my voice so I can proclaim them, right? All choices valid. That experience I had, the profound, overarching, clear awareness that I had was everything is unfolding perfectly. Everything. Now, when you take that in the context of all the suffering that's going on in the world, how can that be? But absolutely, everything is unfolding perfectly. And we are here to make choices and have experiences. You can't have love without fear. You can't have pain without pleasure or pleasure without pain. They're dancing. And so we start to make choices based on love and maybe move more towards pleasure and a better life, or make more fearful choices and have more pain in our lives. So if we can realize that all choices are valid, then we can start to maybe step away from the judgment that goes on at all levels, whether it's religious or political or in healthcare, about what's right and what's wrong, so we can really start to explore what is appropriate for each individual. I only now feel I'm mature enough, experienced enough, maybe knowledgeable enough to start to go, okay, what is the truth? And it's becoming more and more clear that in medicine it's very individualized based on genetics and all kinds of other factors.